Hey, this is Dr. C. Today we're going to do a little bit and probably a second show a little bit on home first aid. So, what is first aid? Basically, it's just the initial treatment of a minor injury at home. You hope it's a minor injury. You need some materials in order to do it. So what I'm going to do is to go through a lot of the different things that can happen at home and how you treat it. And let's go from there. How to make a kit. And incidentally, if you wanted to buy a kit, a first aid kit, first you got to decide what the hell kind of a first aid kit you need. Do you need it for home? Do you need it for work? You're going to send your kid to school with a little kit. Maybe the kid's going to go on a vacation or something, so you want a travel first aid kit. There's all sorts of first aid kits that are out there. We're specifically going to deal with home first aid kits. And there's a lot of things that can happen. A lot of the things, you may not necessarily have to go to the doctor. You got to understand where the doctor learned his or her trade. They learned it in a hospital. They don't deal with a lot of the minor injuries at the hospital. They deal with major stuff. That's why you get the term Dr. Mom. You go to Mom when you're injured, because Mom has the experience to take care of that problem and to ease the pain and give you some comfort. That's very important because when you get an injury, usually you're thinking the worst. And if you're a kid, you're crying, you know? So that's the reason for home first aid. So let's start to deal with it. Let's go through a whole series of different things that can happen to you in a home. So I like to start from the top down, or we could just do it alphabetically, A through Z, or we could go into different systems in your body, like the GI tract, the GU tract, all the different systems. But I'd rather do it from top to bottom, and using a little bit of the A to Z as well. So first thing we're going to deal with allergies. God knows there's a lot of allergies out there. That's an overreaction of your own immune system. That's what it is. So you can get allergies to just about anything. You can get it to foods, like for example, gluten, eggs, peanuts, milk, lactose, shellfish. You got loads of different things out there that you eat, you consume, and you can have an allergic reaction to that. Now, what type of allergic reaction would you normally see? Well, if you can divide them into the mild, moderate, and severe. The mild ones, you may just get a little headache, a little cough, maybe a little bit of numbness in the mouth. That's maybe about the extent of it. Or you may get a little bit of nausea, a little bit of diarrhea, and then it passes. Do you need to treat it with first aid? Well, if it's significant, you might, but you really just need to see Dr. Mom to get a comfort. That's what you really need. Should you have something around the house just in case? And the answer is yes. Yes, you should. What sort of meds would you keep around the house for an allergic reaction? Well, I like to keep stuff like an antihistamine. When I grew up, we had Benadryl. Yeah, believe it or not, even back in the Stone Age, we had Benadryl. And that was it. Benadryl, we didn't even have Tylenol. We just had Benadryl and aspirin when we started out. Tylenol came on later. So, at any rate, antihistamines. Nowadays, you have your choice of antihistamines: Claritin, Allegra, Zyrtec, loads. Now, if you get a respiratory allergy. Like, for example, with plants. Plants, you may get a respiratory allergy if you breathe them in. Also with plants, plants are number 2 on the list. I said foods, number 1. Plants can cause a lot of allergies as well. And you're very accustomed to plant allergies. I'm sure you are. A lot of you, and especially in the Shrewsbury area, you got a lot of poison ivy, poison oak. It's out there. It's out there. So how do you treat it? Well, if it's, depending on, if you breathe it in, the inflammatory process is going to cause your airway to swell. So you're going to notice it in the airway right away. So it starts out with a mild rhinitis. That's where the allergen went in. Then it moves back. You get a cough. Then you have difficulty taking a deep breath in and out. Once you get to that stage of the deep breath in and out, and you're having some difficulty with that, that needs to be treated. That needs to be treated quickly. What do we use? We use an anti-inflammatory medication. You may want to use something like Tylenol. And you may want to use something like a decongestant, like Sudafed, for example. So I always have some Sudafed around. Or I have one of the antihistamines that are on the market. Like I said, the Claritin, Allegra, Zyrtec, I always have something like that around. If it's more severe, you may even have to have Flonase around, which is a steroid, and you inhale it. It's a nasal inhaler. So you may have to do that. Especially people who have asthma. They have a lot more allergies anyway, and so you can use their inhaler as well to help to shrink, bronchoconstrict as well. And so we have that available. So that's for the mild. Now we said foods, plants. What do you do with poison ivy? Well, most of the poison ivy is just topical. Usually you don't even realize you're getting into it because you're dealing with the roots and you didn't understand. Well, it's not a 3-leaf thing. No, it's not. It's the damn roots of that 3-leaf thing. But immediately wash, soap and water, wash the area that's got exposed. At least that gets rid of any additional urosinol, which is that oil that gets on your skin that causes the local reaction. And then you want to deal with the inflammation. You can, for the mild stuff, use just a hydrocortisone cream, for example. Swab that on. Or you can use calamine lotion. That's probably the most common thing that's used. But again, if you have the steroid, the 1% hydrocortisone, you use that. That works well. So what if you get a severe bout of poison ivy? Sometimes you even have to get onto a pill, a steroid pill, like prednisone, and get a quick 5-day course, starting with a high dose down to a low dose over 5 days. That we've done quite often with severe bouts of poison ivy. You're not going to spread it, so don't worry about that part. If it's weepy, if it's moist, I like to cover it. And usually I'll put the cortisone cream on and then a wrap. The wrap consists of the 4x4 gauze, which is right here, 4x4 gauze. You should keep some pads around the house. These happen to be 3x3 pads. They come 4x4 as well. But keep some pads around. Cover it with the pad and then a wrap. What kind of wrap? Depends on where you have the poison ivy. Usually I like to use the Curlex wrap. And I'll show you the different wraps in a minute. So that's for the plants. What else do we have besides with the allergies? Medications. Yeah, we cause as many problems as we solve in medicine. And one of them, allergic reaction to medication. And so medication, allergy reaction can actually kill you. The other things don't usually kill you. This can. Medications can. So what do we have on tap when you have an allergic reaction to a medication? Well, what we can do then, I like to keep an Epipen around. Now, you know what the Epipen is if you have allergies, or you have to get an allergy shot, especially to desensitize you. You have to have an Epipen, which is adrenaline. And so the adrenaline comes in an auto injection apparatus. What you have to do is just take the cap off, stick it onto the, no needle that you see. You put it onto the skin and press the button, bang. It gives you the auto injection of the proper dose of epinephrine. That comes both in a child and an adult dose. If you have somebody with allergies in the house, not a bad thing. Ask your doctor. Get a prescription for an Epipen. An Epipen. Okay. Keep it around. God knows you might need it. So, what other allergic reactions can we have besides foods, plants, medications? How about bugs, insects? Let's talk a little bit about the bugs. Let's say bed bugs. Bed bugs are not uncommon, let's face it. But the more common thing that people get an allergic reaction to are mites, little mites. You don't even see them. They're so tiny. But they cause an extreme itch. And so what do? We use a topical agent to combat the itch. And so that is not an uncommon thing. Not an uncommon thing. They come usually, you can diagnose it not by the actual bite itself, but where the bite happens to be and when you got it. If you get it at night in bed, what the hell? It's a bed bug. If you get it outside during the time that the mosquitoes are out, it's probably mosquitoes. If you got it at the beach, it's probably the little bugs on the beach. All these things you need to have a little history so you can diagnose what caused it. Now, what do you do to treat it? You can use something simple, like a little patch, for example. Now, these little patches and all, they contain just some menthol, for example. Usually, it has a combination of either menthol. This one happens to have menthol in it, and it comes in combination with a local anesthetic, benzocaine. So that is a nice thing to have around the house. They're called Theropatches. And it also comes in a little stick, too. You can take the stick and dab it onto the area of the bite. It gives you temporary relief. Okay, that's fine. So what are the other things that we can do before we leave the topic of allergies? I think I probably was a little short with the minor allergies that we see. A lot of times when you get an inflammatory reaction like a bad nasal or in the back of the throat type of swelling, an inflammatory reaction basically. A lot of times it'll produce a lot of mucus. And so I use a lot of things like Mucinex. Mucinex will cut down on the amount of mucus that you produce. And so it's a good thing, it does alleviate it. We also may use a decongestant, as I said, like Sudafed or like phenylephrine. Those are two over-the-counter that you can get, and it will cut down a lot on that inflammation that are in there. There are some natural products, too, that are anti-inflammatory. Things like eucalyptus, things like just the menthol itself. Eucalyptus is probably the most common thing that's used, and it's a good natural anti-inflammatory. Okay, so I think we've gone through the allergic stuff pretty well. What do we do now? Let's take the B, bites. What kind of bites? Well, obviously the most common is a dog bite. How do we treat a dog bite? Well, you know, the common lingo out there is that there's nothing cleaner than a hound's tooth. Well, when you compare that to a cat or a human, it's true. Dog bites are generally pretty clean. Now, that doesn't mean that you can just go ahead and put a steri strip across. No. You leave it open. But what you do with a dog bite generally is wash it off, which then brings a subject for your first aid kit. You need to have something to clean it. Now, there's two things that we use. I used to use stuff like Physahex, but you can use any type of soap and water. That's fine. But I use a thing called Physahex. Nowadays, people will get chlorhexidine. This is what we scrub with as a surgeon. You scrub with either chlorhexidine or you scrub with betadine, the iodine-based betadine, or you can scrub with an alcohol base. So you can use any of those. But I have, in my little set here, I have chlorhexidine. So that is what I would use then to wash that dog bite. And wash all the way around it because there's dog saliva and stuff that's around that bite as well. Now also, if it's a big dog, he may have clamped pretty hard. So you may get some bruising, in other words, black and blue, around that area as well. So you got to clean all the way around, especially if it's on an extremity. And then you're going to bandage it. What do we use for a bandage? Well, what we have here is an antibiotic ointment. I use either I got them here, either the bacitracin or I'll use gentamicin, just one of the things, neomycin. All those are good topical antibiotics. And then on top of that, I would put a little gauze pad because there will be some drainage. You're not closing it. Little gauze pad. And then I'm going to wrap it. Now, what do I wrap it in? Well, remember we were going to talk about the wraps. So let's do that. What do we put on? On top of that little gauze pad, I may want to put a little bigger one, and then I'm going to wrap. I like to use Curlex. Curlex wrap, nice and soft. Give it about 2-3 wraps, and then an ace bandage. So I keep a couple of sizes of ace bandages around, either a 3-inch, 4-inch. They come 1, 2, 3, 4, and 6 actually. And then some people will use, if they can afford it, they'll use some self-adhesive type bandage as well. Or they may put this on instead of the ace bandage because it sticks to itself. It's a nice thing to have around the house. And if you use an ace bandage, I don't use those clips that come with it. I'll use a couple pieces of tape. So that has to be in your box as well. So the tape, the Coban, which is the self-adhesive bandage, ace bandages all together in your supply. Okay, let's go on. Besides a dog bite, and of course you have to worry about rabies, so you need to know who owned the dog. Find out if that dog had their rabies shot. If they had their shot and it's up to date, you're probably going to be pretty safe. Now there's other animals out there, wild animals, and you may not know. And you may wind up having to have a series of rabies shots in your abdominal wall. You got to do it because you don't want to get a problem with rabies. So get them if you have to. What else? Cat bite. Now, as I said, nothing cleaner than a dog bite, but cat bite is worse. Cats are digging with their claws all the time. You never know what the damn cat's going to eat. They may eat a mouse. They'll come home with just about anything. They're proud of it. They killed a snake or they killed a rat, or it's amazing the stuff they'll chew into, But it is a dirty wound, and you can get a couple of different types of infections from the wound. How do I diagnose whether there's an infection or not? Well, Usually you'll get, from the site of puncture, you'll get a little pink hue that goes, and what I do when I first see it, I'll put with my pen a little mark around the edges. The next time I look, if that pink edge has gone beyond that area, okay, you got an infection. Now, how do I diagnose what the infection is? One of two things. It could either be a staph or it could be Pasteurella. Now, what's the difference? The difference is the degree of pain. Pasteurella is a very painful infection. So if you have a lot of pain associated with it, the pink line is going up further, you got a Pasteurella infection, you need an antibiotic. You call the doctor, you tell them, listen, I got this, pain is involved, it's beyond the area of the ink that I got. He's got to put you on an antibiotic. If he doesn't, you say, screw you, I'm going elsewhere and get treated. So that's what you do. So that is cat bite. Now, you can get other things too with a cat bite. You can get a Bordetella infection from a cat bite. And that goes up to your lymph glands, all the way up into the lymph glands. And then you get a thing called cat scratch fever. You get big swollen lymph nodes. And that's because of the infection that's in the lymph glands now. So cat scratch fever is a bad complication of a cat bite. Okay. What about snake bite? Well, there's roughly in Massachusetts about 20% of the snake bites may be venomous. Most of them around here are either copperheads or a few rattlesnakes that are around. But depends on where you are. You're not going to get this usually in the home environment. Most of the ones that you get out in the garden and all this, those are all non-venomous snakes. But you still have to treat it. It's still a bite. So you still have to wash it carefully with the soap, the chlorhexidine or the betadine, or if you want the sudden jolt of pain, you can use alcohol, I suppose. It doesn't hurt, I guess. So at least give it a good cleaning and wrap it. Always wrap it afterwards. Okay, so that's snake bite. How do you treat then a tick bite? Whoa, tick bites. Now we get educated on ticks every summer, and the one that we're worried about is the little deer tick. It's probably the smallest of all of the ticks around here, but there's a lot of deer, let's face it. So we do see an occasional Lyme disease. Now, when do you start worrying when you get a tick bite? Well, first of all, if you've been out in the woods, you should check yourself anyway, all over, especially if you've had exposed skin, either arm or leg. Any exposed skin, check it out. Make sure you don't have a problem with a tick. Now, if you see a tick and you've only been out for a short time and you see it right away, don't worry. That tick has to embed itself, and it takes roughly about 24 to 36 hours before you begin to get any injection, any inoculation of Lyme or any of the other problems. So you can cure yourself by just removing all of the tick, which includes the tick head. Now, what I like to do if I see a tick, and usually the tick is embedded horizontally like that. Vertically. They go right in. Their head is embedded into your skin, and the body is out here. And so you want to make sure you get the head of the tick. So what I want to do is I want to stun the tick. And what I do is I'll use the alcohol, and I usually have alcohol in my bag. I'll take that onto a gauze pad, put it on there for about the count of 10, something like that. That's enough to stun the tick. That means it's going to weaken. And then you're going to take your your little tweezers. Now, tweezers are very good things to have, and you want to make sure that the tweezers come together right at the end. If they don't, if they're off a little bit, get another pair of tweezers. Make sure they come together right at the end. For a tick bite, you don't want to have a tweezer that comes to a point. You want to have a flat head. And so you're going to take that tweezer, put it right around the tick, and gently, don't twist it, gently pull it out. That way there, if you've stunned the tick, you should be able to get the head out. Well, let's say you screw up and the head is still there. We still got to get the damn head out. So you're going to put that alcohol on again, and you're going to take that tweezer again and make sure you get that central head out. Don't squeeze too hard. Pull it out straight, no twisting motion. Then wash it carefully with your chlorhexidine or betadine or alcohol. Use any of them. And then a dressing, a small dressing on it. Okay, so that is the tick bite. Okay, let's go on. What are we going to do if we have a cut? Well, it depends on where the cut is. Let's say you get it on the head or on the face. Bleeds like stink. Bleeds like stink. So what do? You put pressure on the whole thing. Well, I put it on for 10 seconds. Oh, for Christ's sake, you got to hold it for at least a minute. You got to hold the pressure on the cut, wherever it happens to be. It'll stop. Unless they have a bleeding defect, it should stop. Now, once it slows down or stops, then you can assess what you need to do with it. If it's a nice straight line, you may only need to put a little dressing on it. Now, it's not easy to put a dressing on top of hair. But on the other hand, if it's a girl especially, what are you going to do? Cut their hair right in that circle? No, for cripe's sakes. You just put on a pad on the top of that, and if you have to, wrap it around the jaw and all, so you hold it on. That usually heals pretty fast. So that's the simple way of doing it. You don't get infections usually in a scalp. It's so bloody. There's so much blood supply there, the white blood cells will take anything that comes in. So, okay. Now, what if you get a cut on the face? Well, you don't want to leave a very visible scar. And so you may have to, if it's nice and linear, you could probably get by with a steri strip. Now, what's a steri strip? A steri strip is a little piece of gauze that is very thin, little piece that's thin, and it has adhesive on the two ends. So what you do is you dry it off, very carefully, dry it off, and then you put your steri strip on, or strips, depending. So that's only if it's a nice linear type of thing. So we've gone through the first section now. We're going to come again very shortly. This is Dr. C.